Hi Peter, I'm Scott Arrol and I'm acting CEO for HiNZ, and it's kind of like I've done my internship for the last few months. I've been the program director, so pulling together the program, the speakers and so forth. So and for the HiNZ conference.
Yeah, excellent. It's always great to be in and amongst the digital health community within New Zealand, and the place to do it is here at Digital Health Week with HiNZ THT. Talking Health Tech was here roughly this time last year. A lot of conversations with the health systems and the vendors and the ecosystem. I feel like a bit's changed in the past 12 months in New Zealand. Well, maybe. You tell me, what's happened within the New Zealand digital health space in the last 12 months?
The best way I'd describe it is just it's been dynamic. Like we've gone from, probably when you were here last and everyone else was at the conference, it was quite. I think there was a good vibe. There was looking forward to lots of positive things coming. The messaging from HiNZ and politically was positive, and then just within a short space of time, obviously things have changed, and that dynamically for reasons around the economy and direction of travel of say political policies and so forth. Just trying to get to grips with lots of things in the country at the moment, it feels like, and but we'll come through it. Kiwis are we're a pretty resilient sort of a crowd, aren't we? And already at the conference, we're just finding such a positive sort of vibe around things. So people understand how tough it's been. And there's certainly a period of change that we've just all had to acknowledge, and you just got to work through that.
Well, one might think, it's an interesting time to bring everyone together to talk about innovation and digital health. But I guess when everyone's going through any kind of change, and particularly a significant change, what better thing to do than all come together as an ecosystem to work out, what it means and where to go next. So, when this conversation goes out, the dust would have settled a little bit, but, we're at the start of Digital Health Week now, so I appreciate you making the time, especially with your additional acting responsibilities now too. But tell me about what kind of vibe, or what are the types of conversations we're going to expect over the next couple of days here at
well, I think with whether it's depends where you are in the sector, but what I'm finding, and because I've been involved in the sector, the digital health sector, for quite some time, and in various roles anyway, what I'm picking up on is where's the opportunities. So if you're an industry partner, if you're in the business side, we've got so many that have come along. We've got the gold support of the gold sponsors, which has been great. They want to know where to position and how they're going to work, and the relationships and the interactions that are important to them, so that they can be adding value in the best places. If you're a HiNZ employee, staff member, a lot have actually paid for themselves to come. They want, they might have got the registration through their HiNZ funding, but they're paying for their own travel and accommodation, and they want to be here because they just it's their opportunity as well. Clearly uncertainty for a lot of people, and that's that is what it is, unfortunately. And so we're just trying to provide a safe place. People can come and have a chat, get to know each other. I think it's always a good chance at the HiNZ conference. Next year we're in Christchurch at Te Pai in 2026, so that's going to be an even. I think that's a special vibe that we're going to be building for that. We'll be 12 months down the track. Lots of things will have happened over this coming 12 months, and I think what I've generally found, and I've been in the sector a long time, we're a pretty resilient bunch. I just keep coming back to that. So, yes, it's tough, but we're tough people. It's and everybody's working to achieve. We often say when we get to a point where digital is not referred to anymore, it's just healthcare. It's what we do as part of healthcare in the country.
And for those that are attending, perhaps, in the vendor crowd or the providers, those that are helping the health systems navigate these challenging times, they're, you mentioned too, they're keen to understand where the priorities, maybe where the opportunities are to be able to help the clinicians, health systems, work in these turbulent times. What are the types of advice or suggestions you have, given that there's not ample budgets for investing into new technologies? Is there still opportunities for these companies to support during this unique time?
Yeah, there is, and I guess I've had a mantra for a long time anyway, and it's about relationships. You know, who are you working with? Who are you not working with? Who perhaps you should be? Just what is it that the sector is going to be able to? What are they going to need? So that's, and I think it's, we've gone through a period where the wording has all been around innovating. Like we've got to innovate and not to belittle that, but I think we're now entering a period of what have we already got, what can we improve on, where are the connectors. I think there's a huge opportunity for industry players who are connectors. They've got their own system, but they connect with other systems. Standards-based is important. I think it's fundamentals. That's what, in a way, in a good way, sort of back to the future type stuff. It's where's your fundamentals, and I think improvement. There's going to be a period of just sticking to the knitting. Let's get things improved. Innovation will follow once the platforms are set.
Yeah, building that foundation and getting the basics right, and there's still a lot of work to do in healthcare to do that. So, yeah. And lastly, for those that are thinking about the future, is it continuing to do a lot of that? Perhaps the health systems too. They're under. There'll be more pressure in terms of needing to do more with less, and we've always talked in healthcare about the need for increased digital literacy and people to be able to use technology better. Are you finding there's more interest in technology, or perhaps the types of people that would be attending here at HiNZ to try and address some of these challenging situations like that are in New Zealand right now?
Yeah, absolutely. I think there's a truism now that, and it's going to get even more true, not less, regardless of what's happening at the moment. Is digital is here to stay. We're not. There was a period I can remember where we were almost trying to convince that digital was important or should be included. Now everybody gets that. The next stage is, how do we get that to that point where it's just embedded? And clearly we've got to get the fundamentals right in certain areas. But literacy is incredibly important. I think trust. I think trust is huge. I think when people, I've seen the trust factor get better. As I say, the last 5 years, but I think it's still got. We've really got to ramp that up. We've got to be able to ensure patients or the citizens understand, hey, I can trust this, and I can trust the people that are behind this, and that has to be based on standards and just getting those things right. And with the advent, of course, of AI and how that's going to play out over the, because with the whole Moore's law thing. We're really, it's almost like that curve's going vertical now, Yeah. And and that brings a whole more factors around trust. How do I trust this? Has it actually even been created by a human? So we're going through quite a fundamental shifts in our society. So digital health has got a big part to play in it.
You sure do. Yeah, it's not an optional extra anymore,
no.
That's for sure. And that trust piece is critical. And if we're in a vibe of needing to do more with less, obviously inefficiency through large language models and AI are going to play a key part. Any final thoughts before we let you loose amongst the attendees at morning tea here?
Final thoughts is just stick with it. There's always, when times it's, I don't want to be into too many cliches, but there are always opportunities. It's finding them, and who are you going to? I just keep coming back. Who's the relationships? Who are you going to work with? Who aren't you working with now that there's a possibility you should be working with? And just make sure whatever's done builds trust, doesn't erode it.